the next piece here is Donald Trump lied so much about COVID. He lied so much about COVID. And people just throw their hands up. Oh, we all know he's a liar. But it has consequences. Creating that initial lie about this being a flu, creating that initial lie that one does not have to wear masks, has consequences. And what I want to do here is I want to show you a piece. I cut a few clips out of a piece done by Katie Tur with what's going on with one ill patient, sick patient, and also the rationing that's going on in California. And I want to put another piece of narrative onto that after we play. So check this out, and then we'll take it on the other side, because I think it is very important that we understand what's going on here.
I didn't wear a mask. I should have. I believed this was just a flu. That it was all going to go away. That it was political. I didn't think a mask would help. You don't want to end up like me.
You can see how hard of a time he's having breathing. A warning from that patient in Florida to the rest of us. The virus is serious and it is still spreading, and it's spreading even faster now. The United States is now approaching 21 million infections. That is before what officials worry will be the height of the post-holiday spike. And it is alongside news that the new, more contagious strain of the virus has now been found in a fourth state, the state of New York. Meanwhile, out in California, the state's largest county is telling paramedics not to bring the sickest patients to the hospital unless they have a chance of survival. The hospitals simply don't have the room. This is quite a directive to ambulances, Aaron, in Los Angeles County, that they don't have the space to even try on people who are likely not going to make it.
Yeah, that's right, Katie. This is a desperate situation. You can see outside this hospital in Burbank, triage tents have been set up. Joining me now to talk about the situation is Dr. Angelique Campen. Dr. Campen, if you can just explain what this means, this edict that has gone out to ambulance crews not to bring patients to your hospital, the sickest patients, the ones that are very likely to die. What does that mean for you?
Well, I think this is the first that you're going to see of having to make the tough choices of rationing care and not putting our very strained resources towards patients that have very little chance of survival. It's already been a protocol that not to move a patient until we've established that they've had return of circulation. We've been able to make exceptions to that rule, though, when they contact us over the radio. But now paramedics have the authority to stop all efforts on their own.
So what exceptions are you talking about that will no longer be made?
So if someone does not get return of circulation, their chance of survival is 0.1%. To transport that person to the hospital will require all hands on deck, lots of resources put to them, at the peril of the others that we're trying to take care of in the emergency department. So this is the hard decision that we just can't. We don't have the resources to do that. So those patients are not coming to the emergency department at all.
And the ambulances are also rationing oxygen. There's also potential for crisis standard of care to be declared at hospitals throughout Southern California as well. That hasn't happened here at this hospital. Why?
That hasn't happened yet. We are up against the wall. We are really operating at our absolute maximum capacity. We have not yet, I do not feel that we have yet not been able to care for a patient. But my fear is any increased volume is definitely going to put us over the edge. So this is the time to act now and prepare for what's to come before it happens.
Dr. Campen, thank you. Katie, back to you.
I'm struck by this whole situation that we're in. We are the wealthiest nation in the world. We are the most advanced nation in the world. We are a nation that people come to seek the best health care in the world. And we're now in a situation where we're rationing care, where there's worries about supplies of oxygen, and we're a nation that can't get the vaccine out even though we have a stockpile of it.
Now think about that. I want everybody who remember when we started to have the Medicare for all debate, when we had the Obamacare debates. Everybody was talking about the perfection of the private sector. The private sector does everything so much better than the public sector. That, you know, if you went to Medicare for all, you'd have shortages, you'd have rationing. No. You have rationing in a private sector when the private sector decides to optimize for profit making, for shareholder value. That is the reason why you don't want to have health care in the private sector. The dispensing of health care in the private sector is a clear and present danger to your humanity. It's a clear and present danger to your health. It's a clear and present danger to your life. I mean, because remember, the first, as Milton Friedman said, this is the newest god of capitalism. He said, the responsibility of the directors of any company, first and foremost, is shareholder value. Please, folks, understand what that means. Please understand what that means. It means that we don't care about you. We don't care about your humanity. We only care about making money for the shareholder. That is how it's defined. Let other people worry about creating the channels for humanity. To which I say, I agree. So let's go ahead and take healthcare out of the inhumaneness of where it is right now and put it where we think about people first, humanity first. Is it possible? Of course. Can we afford it? Of course. If you take a look at what the wealthy has amassed, and trust me, they did not amass that out of what they are worth. They amassed that out of a rigged system that gives their capital appreciation, the ability for them to take more. I'm trying to modify some of my language to be more clear, is what a few people have told me. What they do. The wealthy, they're nothing special, no better than you are, because in reality, you are the one who make everything. You're the one, if you're a secretary, you're the one who move the papers around. If you're an engineer, you're the one who take the work of the scientist and make something usable out of it. If you're a doctor, you're the one who heals. If you're a nurse, you are the one who assists in the healing. The people who make things happen are mostly the ones who will never amass capital. Capitalism was designed to allow a few to steal from the many. That's what it really is. The theft from the many. And nobody wants to tell you that because we have been indoctrinated into thinking otherwise. The clean way about it, just think of Jeff Bezos. Jeff Bezos owns Amazon. He's worth more than anybody else. What did Jeff Bezos do? Jeff Bezos got engineers together. Jeff Bezos got marketers together. Jeff Bezos got all the people that know how to do work. And then says, I'm going to take a piece of that, a piece of that, a piece of that, a piece of that. I don't need to know how to program a computer. I don't need to know how to sell a book. I don't need to know how to do any of that. I am a capitalist. Right? Understand what it's all about. Somebody enslaving you, somebody making their worth off of what you are really doing. But they, by themselves, can do absolutely nothing. And when we start to understand these concepts, we can go to Congress. We can go to our politicians and say, we don't want to hear that crap about how is that going to affect business. We have to ask first how it's going to affect us, the masses. That's the first question. And if business benefits, great. If business have to pay, great. But the first thing we have to look out for is you. And when we put in our heads that is how the system should work, when the threats come like, well, we will just stop being kept, we'll just take our business somewhere, tell them, go. Because you know how capitalists were able to continue to abuse? They had the police, they had the art, they had the military to be able to go around the world and abuse. They have the police to be able, again, they are completely non-functional without what we have to offer. It is important that you see your worth. It is so important that we understand that we, the majority, the masses, we are the ones in control. Right now, we are simply a bit brainwashed. They keep 10% in great shape because 10% of the people can keep the 90% in check. While the 1% lives a great life and the 0.1% live a life you could not even dream of. And this isn't class envy. This isn't any kind of envy of any sort. This is just saying we have to be able, folks, to understand how all of this work. And when we understand how all of this work, we can then demand what is ours. You know, when you work for Exxon, and whenever you go to Exxon and you're reading the business section, and you see that this guy got a bonus of $10 million. That is $10 million they took from you. When they said that, oh, they paid X amount in dividends for people who are just sitting down at their pool sipping tea. That dividend that they're paying to those stockholders, that's your worth. Some people, there's a woman, I was at a book club once, right? And this woman was pissed at me. She said that I spoke the way I speak. You have to remember Egberto. Everybody doesn't want to go ahead and own their own business. I agree. Everybody don't want to be, some people don't have a problem working for a corporation. I agree. So don't be calling those people slaves or anybody who just, I'm like, I disagree. If corporations compensated all its people based on their worth, I wouldn't have a problem saying that. But that is not what happens. Whenever you see a select few in a company get big bonuses for work that you do, you should be revolting. You know, there's a vice president goes and he has a big meeting. And he says, okay, what we want to do is we want to reduce our expenses by 15%. Okay, so to reduce the expenses by 15%, they go to the managers. The manager is part of the 10%. Go down and say, okay, how can I reduce 10%? I cannot increase the salary of my people by this amount. I can reduce the amount that I have to pay in healthcare, which means that the employee is going to have to pay a little bit more in healthcare. I can create a little cheaper this here. I can make them be more efficient in putting out more widgets per hour. And then that is the way we get to the goal of saving 15%. Okay, goal met. We were able to reduce all those costs. And you go back to your vice president. Vice president, we met our goal. We reduced our expenditures by 15%. And then 15%. And then the vice president goes to the meetings and says, oh, we all did what we were supposed to do. We are great administrators. We are great executives. We saved the company 15%. And for that, the vice president gets $10 million. The shareholders get the mass of the 15% in savings, and the workers get screwed. And they say, oh, but, he did a great job. That's why he got a bonus. He didn't do the job, people. He didn't do the job. Understand that it's you who did the job. Understand that it's you who got conned. Understand that understand that the benefits he's getting is based on what he has taken from you. And but they don't express it in those terms. They saved the company. So in order to save the company, I gave you less, took a lot more, and gave the shareholders more. It's always you who are paying. You say, I can't do anything about it. Of course you can. And what do? Make sure that we continue to share these programs and instruct other people about how the system works. Because until we do that, they will continue to pilfer us. Until we do that, they will continue the same concepts that continue to screw us all. We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead, number 1, subscribe to our channel, and number 2, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.